and welcome. You're with IndiaPostLive.com, India's first live interactive web television. This is a platform where you can engage with us as we talk of different issues. You can share your stories with us, send us your video comments, your posts on India Post Live. Also tweet us at #IndiaPostLive and @IndiaPostLive. Today we are here to take a holistic, larger picture of the situation, the condition of the women's reproductive health as far as India is concerned. I'm sure you all agree when I say that the woman's reproductive system is complex yet very, very delicate. It is something, the health of a woman's reproductive system is not something that one should take lightly at all, yet it seems that we do. There are issues of preconceptive health, there are issues of unwanted pregnancies, complications relating to a woman's menstrual cycle, the whole ambit of pregnancy and childbirth itself. Who really cares about postpartum depression? Who knows about it? Who recognizes it? And then, of course, the complications relating to menopause, where there are hormonal changes in a body leading to osteoporosis, leading to mood swings, and all the other complications that go with it. So since the time a child is born till the very end of her life, the woman's reproductive health is something, the health is something that has to be taken seriously, has to be tended to, has to be cared for. But are we doing it at all in India? You know, two very interesting news stories that have come up in the past few weeks. First of all, the deaths in Chhattisgarh after a sterilization drive. And secondly, the new government wanting to bring in amendments to the MTP Act, that's the Medical Termination of Pregnancy Act. Now, the Indian Medical Association has come up in arms against the changes. So we're going to discuss all these aspects. First of all, I would like to bring on your screen an infographic that has been released by UNICEF. This is a 2012 statistic, a demographic report. Let's take a look at that before I introduce our online guest. It's coming up on your screen right now. Demographic indicators of 2012. That is our net population, knowledge about HIV seems to be very, very poor, not as poor as probably, one would think. But in terms of the affluent families, it is all right, but in terms of the non-affluent, it is not. Knowledge about HIV, again, is not as high among the poor people. Crude birth rates in India: in 1970, 38.3, 1990, 30.7, 2012, 20.7. That's the birth rate. And the death rate in India: 1970 was 16.4, 1990 was 10.6, and 2012 is 7.9. So these figures look encouraging, of course. However, the question we're asking is the women's reproductive health in a deplorable condition or not? Okay, life expectancy of India: 1970 was 48.8, 1990 was 58.5, and 2012 it's gone up to 66.2. So an increase in life expectancy there, of course, better health measures, probably more education. Those are the global standing reports. We have a death rate of 8th in the world. Human Development Index, we are 134. That definitely is deplorable, and I will be talking about that. All right. So those were some demographic figures that we saw in a report released by UNICEF. That's a 2012 report. Let me now bring in Dr. Bobby John. Dr. John is a physician and president of Global Health Advocates. He joins us online to discuss the entire issue of women's reproductive health in India. Dr. John, thank you so much for joining us on India Post Live.
Thank you for having me with you.
Thanks. We saw some encouraging figures there as far as life expectancy goes, as far as death rates go, as far as mortality rates go. However, I think that these two issues, the Chhattisgarh deaths, as well as the whole change in the MTP Act that the government proposes to bring about, I think that we at India Post Live thought that women's reproductive health needs to be talked about. What are your first thoughts when it comes to the state of women's reproductive health in India?
The first thought is of astonishment. Astonishment that we have made so much progress over the last 5 or even 4 decades,
Yes.
and yet we have failed miserably in addressing ourselves to the issue of quality of service. In the aggregate, if we have saved over the last 40 years of record keeping as per the UNICEF's report, we have increased life expectancy by nearly 2 decades. It's not because we've paid attention to quality, it's the sheer numbers that we're talking about. If we had concurrently paid attention to quality, and I'll come to women's reproductive health in a moment, we should have seen that number jump up significantly more. Which brings me to the quality of service. Women's reproductive health is central to humanity. You cannot have human progress and the progress in civilization happen without paying attention to what the place and the role that women play in the human life cycle.
Absolutely.
And then within that context, to pay scant respect to the quality of services that a woman receives, whether as a teenager, whether as a pre-pregnant woman, whether as a pregnant lady, whether as giving birth to a mother who's just given birth to a child and is figuring out how to provide for her newborn kid.
Right.
But in any of these settings, the attention to detail and quality for a woman's life and her circumstances, that's been grossly missing. And I'm astonished that we have progress in spite of all of this.
Exactly. I mean, I don't know if it'll come out in a very funny way when I say it, but the fact is that it's deplorable. The quality is bad. The service is bad. We still have so many women who give birth at home. That is home birthing. They do not, no one really talks about the medical complications, after childbirth. There are midwives still. There's home birth, and yet we are growing also at astonishing figures. We are, the human population in India is increasing, So why, I mean, how do you explain that really?
And that's the big story.
Yeah.
This is like a giant truck that began slowing down some 30 years ago. We have slowed down dramatically. If we had not slowed down, we wouldn't be at 1.25. We'd be at a far bigger number. So that's very good progress.
Okay.
But that progress is coming despite our slippages in quality, slippages in providing for women who deserve far better than what they are getting right now. So let's leave aside the population absolute numbers. Let's leave aside the growth rate. Let's focus on where the quality is.
Right.
The quality is to be assured to every woman who gets pregnant, whether at home or whether she chooses to go at the hospital. Over the last decade or so, we've tried to push enormously all women to have an attended birth. A birth that is attended by a qualified provider of services, whether it's a trained birth attendant at home or whether it's an institutional delivery. Institutional delivery provides for a few more assurances. And so therefore we have done a fair bit of administrative push to get women to deliver at hospitals or in healthcare centers. It's only beginning to bring in the results. But what's the quality in these centers that we are pushing our women to? If it is going to be a primary healthcare center like the one that we saw in Bilaspur, where facilities are rudimentary, where people, even if they are available, their skill sets are not ratified periodically, where there's no continual supervision, then what we have are numbers devoid of quality. And that's the big flag that comes up from the incident over 10 days ago, which is Women who came in for a health service, who should have gone back happy and alive, unfortunately are dead, and their kids don't have a mother anymore.
Absolutely. There are so many families that have been completely orphaned. The whole situation, what happened in Bilaspur, brings me to one question. You talked of the fact that there is progress, the fact that we have been able to control our birth rate to a large extent. We also saw that in the UNICEF's report. Does India actually need this kind of a sterilization drive? Do we need it? I mean, aren't public awareness messages that we see on television and radio and other such platforms and print, aren't they enough? Do we actually need to do these sterilization drives where women are paid a certain amount of money to for a surgery?
Let's face it, women, men will plan their families according to what their desires are and what their circumstances are.
Yes.
When circumstances are positive in their favor, they will desire smaller families. When they desire smaller families, they need access to services, they need access to products that will enable them to fulfill that wish, that desire that they have of limiting their family sizes. And we've seen this across the planet. Whenever there's been better health conditions, whenever there's been better education for women and for men,
Yeah.
whenever women have been able to find work and employment and satisfaction in their larger lives, they have been able to provide for their child or the number of children that they desire to have. So it's not a question of should we have sterilization or should we not have sterilization.
Okay.
It's a basket of services that a woman and a man need through their entire reproductive cycle. They will need something when they have not yet got pregnant. They will need services when they have had a child and do not want the next one to come very soon. They will need a different kind of a service when they've decided this is it, we don't want any more children. And so it's a spectrum. So you could have condoms or you could have oral contraceptives when you do not want to terminate your ability to have a baby. You want a spacing method when you want space between your two children.
Yes.
When you don't want a child, you will look for terminal methods, sterilization being the option for both men and for women. In India, sadly, sterilization is the tool that is offered most widely, and even within that, it's 99% women.
Women, right.
I've done a couple of thousand female tubal ligations myself, and in my entire working life as a physician, I've done one vasectomy on one man. And that's a scale.
Ouch. Okay.
If we have to talk about family planning, two things. One is there's a full gamut of services that need to be provided for. And second, the onus cannot be just on women. Men have to be part of this conversation. And sadly, in all this hullabaloo, we have missed out on bringing the role that men need to play, and they need to step up to their role and responsibility that's required of them.
So men partnering in this entire initiative of the women's reproductive care, that is, you're saying there's a huge lacunae in that in our country.
But reproduction happens with both men and women working together.
Yes.
I mean, reproduction does not happen in isolation with women alone. And so
Right.
if that burden of controlling reproductive capability has to be borne and equally by both the man and the woman. And that starts much, much earlier on, long before the conversation of a marriage, long before the conversation of a pregnancy. It needs to be good, high quality information and the services that need to be in the hands of young people.
Okay, I just want to ask you something that just struck me while I was talking to you. You have various communities, in India, where when a woman attains puberty, there is a festival. I've seen that down south also. There is a religious festival, and relatives are called in, and all of that. But talking of a woman's menstrual cycle itself in common parlance is taboo. So that contradiction itself is very, very real in our society, isn't it? One doesn't talk about a woman's menstrual cycle. One doesn't provide, especially in low-income areas, in slum areas, women do not even have access to sanitary pads, to sanitary napkins. And on the other hand, when a woman attains puberty, the fact that she is now entered a stage where she is able to give birth, at some level that is being celebrated. How do you explain this kind of a contradiction, doctor?
You mentioned India being the second largest country in the world. I mean, with 1.25 billion people,
Yeah.
you'll have 1.25 billion contradictions also.
Right.
We will celebrate motherhood, we will celebrate the woman, we will celebrate the coming of age, and then with the same disdain, with the gusto that we kind of celebrate, we will exhibit disdain to the facts and realities that this woman, this child, this girl needs to go through every day of her life.
Right.
I mean, we talk about talk about sex is taboo in this country, talk about sexual reproductive health is taboo in this country, and yet in a country where sex really doesn't happen, we've got 1.25 billion Indians to prove that it happens a lot. Right?
Absolutely. Absolutely.
Breaking that needs, to my mind, the best vaccine to this taboo and this kind of cultural norm is an educated girl.
Right.
We have to figure out, and I'm sorry to kind of divert away from the reproductive health thing.
Not at all.
Unless we have the tool within the hands of a girl early enough and good enough, we will not break this cycle of taboo, of disdain, of making sure that there is neglect for women in their most vulnerable situations in their life cycle.
Right. And also, one thing that I would like to come to, but before that, I will, just tell you, we have on the phone line Jagmati Sangwan. Jagmati Sangwan can join us for a very short time. She is a social worker with IDVA, and she is here to talk to us about her thoughts on the women's reproductive health. Ma'am, welcome to India Post Live.
There is no sufficient infrastructure provided for the delivery system and this all. Whereas this is a very sensitive area of health, and particularly in rural areas and in tribal areas, this health infrastructure is comparatively more less.
Ma'am, what about, I would like your first reactions to, what happened at Chhattisgarh, the fact that so many women died after the sterilization drive. How do you look at it?
We have been observing that this quota and target-based population control policy, it is being implemented in such a way that these women are made to pay very high cost. And the same thing has happened over here. When they are under pressure, these doctors, they want to complete their quota and target. And for that, they know that by announcing some meager amount as incentive, they can attract poor women in large numbers.
My last question to you, you are aware that the government is planning to bring in an amendment in the MTP Act. Now, the Indian Medical Association is up in arms against it, especially because of the fact that it allows midwives and Ayurvedacharyas to perform abortions till as late as 24 weeks. What is your reaction?
We, the women organizations, have already lodged our protest that we are against it, and this is somehow to pursue for private hospitals entry in this area, and at the same time, after 24 months, if you are allowing this abortion and this all, there are so many allied issues before clinching in favor of it.
Right. All right. Jagmati Sangwan, President of the All India Democratic Women's Association, thank you so much for joining us on the phone line. And Dr. John, let me just get back to you. You heard Jagmati Sangwan. She says that all women's organizations are also up in arms against this new amendment, the proposed amendment in the MTP Act. How safe is it to conduct a medical termination of pregnancy, till as late as 24 weeks?
The safety profile of conducting a medical termination of pregnancy decreases as the number of weeks of pregnancy advances. The safety profile actually goes against the woman, both with time and also with the decrease in the availability of skills in the hands of the person conducting it. So it's a sliding scale. You increase the number of weeks and you don't have competence on the other side, the chances of a disaster are far more exacerbated than earlier and in the hands of a competent person. So the devil is in the detail. Whatever the proposed MTP Act will be, if it allows for untrained, unqualified, unsupervised personnel to carry out these terminations, and particularly in stages after 12 weeks, between 12 and 24 weeks, then I'm quite happy to be aligned with all the women's organizations that are opposing the way things are being proposed.
And also the IMA. All right. Okay, let
and everybody, because beyond that, it requires high quality skills, it requires clinical settings that are equipped to handle emergencies.
Right, absolutely, absolutely. So again, like I said, women's reproductive health is hardly taken very seriously, and it's kind of a lot of factors are not being taken into consideration when a lot of these policy decisions are being made. Okay, let's take a look at another UNICEF report now, coming up on your screen right now regarding this entire issue. Women's health, okay, contraceptive prevalence, antenatal care, at least one visit, antenatal care 4 visits, delivery care, institutional delivery. Look at the delivery care C-section, that is really lacking. That's only 8.5. Also, when it comes to child protection, child labor and child marriage by the age of 15 is 18.2, child marriage by 18 is 47.4%, and birth registrations is only 41.1% in this country. In urban areas, it's 59%, rural is 34.8%. Skill attendance at birth, urban is 75%, rural is only 43.3%. So that is exactly what Dr. John was talking about. Underweight children under 5, urban 32, rural 45. Diarrhea treatment, again ORS is administered less in rural areas than in urban areas. Okay, if we are going to talk about the fact that drinking water, these are all allied resources. 91.6% are using improved water, but urban is 96, rural is 89. So drinking water sources, I believe we have quite a satisfactory number there. Improved sanitation facilities, of course, it's deplorable again. Rural is only less than 24%. Urban is less than 60%. And on an average, only 31.5% of the people are using sanitation facilities. HIV prevalence, women living with HIV patients is 7.5 lakhs. Adult prevalence in 2002 was 0.3%. And like we just told you a while ago, we're just bringing that back for you. The richer, the better socio-economic background people, they have more knowledge. The women have more knowledge of HIV than the poor. Poor is only 3.8%. And females, 19.9% only are aware of HIV. Among the males, definitely knowledge is more. Rich, economically better is for 55, poor is 14.7, total is 36.1. Knowledge of HIV more prevalent in males than in females. Again, like Dr. John said, that also has a lot to do with basic education. When you talk of clean water resource, when you talk of, Dr. John, when you talk of attendance, qualified attendance at birth, when we talk of sanitation, when we talk of HIV, these are all issues, which are allied issues. You can't just see any one issue in isolation. I'm sure you'll agree. And all these find their way back to education and awareness, isn't it?
Let me pull out two numbers from the many that you've kind of just put on the screen.
Right.
One, only 43% of women in the rural areas have access to trained birth attendants or trained services at the time of delivery.
Right.
That's just half of what is available in the urban settings. Okay.
Yeah.
And the second one is less than a quarter of people in the rural areas have, and particularly women, have access to sanitation facilities.
Yes.
And both of these are interlinked.
Absolutely.
I mean, when you talk about taboo around menstruation, when you talk about taboo around reproductive health, when you can't provide for safe spaces, sanitary spaces for women to be in the comfort of a privacy, a private place, and have clean water, to be able to clean themselves and to be able to be in a secure environment, what you have is both women who won't be able to go out.
Absolutely.
Exacerbation of ill health.
Yes.
And when they eventually do get into facilities where they, or situations where they need the help, what you get is half-baked skill. Both of them together are a double whammy against women in the rural areas. The urban areas, while the numbers are higher, again, going back to my earliest point, which is around quality, if there's not adequate supervision, we do not know what the women are getting for the money that they're spending. And chances are they're spending far higher for quality that's far lesser than what is supposed to be delivered. In both cases, whether it's rural and urban, women, especially during their reproductive age group, are grossly shortchanged in India.
Absolutely. I mean, rural women, since they do not have toilets in their house, they have to get up early in the morning before sunrise and go out to the fields or wherever to defecate. They hold back, and it's not just about defecation, even passing urine. I mean, they have to hold it back for the entire day, and only then can they go. So they are, causing, their health is, the kidney functions are completely getting compromised. And of course, talking of sexual predators is a different issue altogether. So with situations like that, when they are, undergoing their menstrual cycle, also they are in a similar situation. So as far as sanitation is concerned, as far as basic facilities are concerned, they are deprived.
Sanitation is not going to be about a 4x4 cubicle with a pan at the bottom. Sanitation is much more than a toilet. Sanitation is a whole mindset.
Right.
Sanitation is an ecosystem where there is water, there is a cubicle, there is an ability to dispose of human waste, and there is a sense of dignity around it, and particularly so in the case of women who have to use these facilities.
Absolutely.
Well, I'm all for Swachh Bharat. If it does not have a larger ecosystem and a thought process built around the outcome of safety and comfort for women, particularly in their most vulnerable days of the either the monthly cycles or the reproductive cycles, then what we'll have are meaningless cubicles that people use, as we have seen in the past, for storing grains or of just lying abandoned, than actually achieving the mission of total sanitation in this country. We have to measure sanitation in how women's health is improved, how the incidence of reproductive tract infections among the women are reduced, how they are able to then go about their normal lives. And if we don't do that, I'm sorry, we'll have all the grand programs, but we will still have one half of our society still struggling with the same issues that it struggled with in the absence of these programs.
Absolutely, Dr. John, you have kind of summed it up very nicely for us. In fact, I was also about to, get into another talking point of depression and hormonal changes and postpartum depression. But when we are dealing with a situation where the basics are not being provided for, depression is also something that no one talks about. No one, probably in some urban educated households, one does understand these things, but in the rural households, no one talks about it, no one recognizes it, no one is even aware that they're going through something like this. So I think we'll keep that for another day. I think you'll agree that we have a lot to go, and like you said yourself, and like the numbers told us themselves, we have a long way to go as far as women's reproductive health is concerned, when the basics of education, the basics of awareness, the basics of sanitation is not provided, and the basic dignity when it comes to a woman's reproductive cycle is not being provided to her, then definitely we in India have a long way to go to ensure that a woman is confident about her body, confident about the changes taking place in her body, preconceptive, during her reproductive cycle, during her pregnancy, after her pregnancy, and also after menopause. So definitely a long way to go, as Dr. Bobby John said. The situation is not very positive. We do hope that through programs like this and with the efforts of doctors, physicians like Dr. John, and also with organizations like EDVA, we come some further, we cross that barrier and women's health is taken care of. If all of you, we have to wrap up the show now, but Dr. John, it was great having you. Thank you so much for putting things in perspective for us so nicely. If all of you have anything to share with us regarding that very burning issue of the women's reproductive health in India, do write in to us at India Post Live. Do send us your video comments and tweet us at #IndiaPostLive and @India Post Live. Thank you so much for watching. Bye-bye.